Good morning, children. Today we are going to talk about medical termination of pregnancy. In the past, we have already talked about, in the previous lecture, we have talked about various kind of birth control methods. Now let us talk about MTPs. Now, the full form of MTP is medical termination of pregnancy. Involuntary or intentional termination of pregnancy before the full term is called as medical termination of pregnancy or induced abortion. The government of India has legalized MTP in 1971 with strict conditions. Why MTP is essential? The answer is to get rid of unwanted pregnancy, either due to casual, unprotected intercourse or failure of contraceptive methods. In certain conditions, even in the case of rape or coitus, MTP becomes essential. Now, there are certain side effects of MTP. That is the reason why MTP is legalized with strict condition by Government of India. Now, MTP are considered relatively safe during the first trimester. Now, first trimester means 3 months. During that particular stage, it is considered to be safe. But it has been observed that in most of the condition, people go for MTP after the third month. That is in between third month and sixth month. Why this happens? This happens because in most of the conditions, especially in India, it has been observed that people go for amniocentesis in order to find out the sex of the child. They misuse this process in order to find out the sex of the child. And then when they find that the child is a girl child, they usually abort that girl child. Now this is responsible for especially this is responsible for decrease in the sex ratio of our country. The number of girl babies is getting less, and that is the reason why there is a statutory ban on amniocentesis. Now let us talk about indications when MTP becomes necessary. Women whose physical or mental health is endangered by pregnancy. There can be certain conditions. Now, women facing the problem of potentially handicapped or malformed child. Now, a child with Down syndrome. Do you think that child will be able to adjust in the society? No. It will be a problem for the parents also to bring up that particular child in the world. So in that particular case, MTP is legalized. Then in case of rapes, even in that case, it is legalized. Pregnancies, especially in case of unmarried girls under the age of 18, in that particular case also MTP is legalized. Pregnancy that results due to failure in sterilization. Now, in that case also MTP is legalized. Now, and MTP should not be performed by unqualified quacks because it can be dangerous. Moreover, guidelines regarding MTP should be followed. Now, let us start with another subtopic in the same thing, that is sexually transmitted diseases or STDs. Diseases or infections which are transmitted through sex intercourse are collectively called as sexually transmitted diseases or venereal diseases or reproductive tract infections. तो 3 नाम हो गए, sexually transmitted diseases, venereal diseases, reproductive tract infections. बहुत सारे ऐसे डिजीज़ हैं जिनको हम सेक्सुअली ट्रांसमिटेड डिजीज़ में जिनको कहेंगे, जैसे कि गर्निया सिफिलिस, ये बैक्टीरिया से कॉज होती है. जेनाइटल हर्पीज, दिस इज कॉज बाय वायरस. कैलमाइडर्डियासिस, CHLAMYDIASIS, this is caused again by bacteria. Then trichomoniasis, this is called by protozoans, single cell protozoan. Hepatitis, this is called again by virus, hepatitis B. HIV, this is again caused by virus. So there are so many diseases which are caused by viruses, bacteria, especially viruses and bacteria, and there are certain diseases which cannot be cured. For example, hepatitis B. It is transmitted through blood as such. HIV, it has no cure. Genital herpes. These are three diseases which do not usually have a cure. Apart from that, all other diseases have a particular cure as such. So there are certain symptoms of sexually transmitted diseases which should not be ignored. For example, itching, burning, pain sensation, inflammation. If such things are ignored, they can have complications such as pelvic inflammatory diseases, abortions, stillbirth, infertility, ectopic pregnancy और इवन कैंसर ऑफ द रिप्रोडक्टिव ट्रैक। अब यहाँ पे दो तीन चीज़ें हमें बतानी, जैसे कि स्टिल बर्थ क्या होता है। स्टिल बर्थ इज बर्थ ऑफ अ डेड चाइल्ड। इकोटोपिक प्रेगनेंसी का मतलब होता है एक इकोटोपिक ECTOPIC का मतलब होता है implantation which usually occur in the uterus. It does not occur in the uterus, it occurs in fallopian tube. So that in these cases, these cases can arise due to sexually transmitted diseases, and that is the reason why at an earlier stage one should consult to a competent doctor. Now let us talk about HIV, because you know HIV is also a sexually transmitted disease. HIV can be caused due to unprotected sex with an infected partner. Sharing of needles, especially you know that in certain people who are drug addict, they share the same needle. In that particular case also, HIV can be caused. Transmitted from infected mother to the fetus, this can also happen. Infection from blood products. So these are all the things which has to be taken care of. Now let us talk about home assignment. Write a brief note on MTP. So I've already told you about what is MTP as such. Give some examples of STDs. So gonorrhea, syphilis, genital herpes, genital warts, HIV, hepatitis B, ये सारे, chlamydomoniasis, trichomoniasis. These are all examples of STDs. What are symptoms of STDs? So inflammation, burning sensation, itching. So these are all symptoms of STDs which has to be taken care of. Thank you very much. I hope you like my topic.